Cancer has long been a formidable foe, with treatments like surgery, chemotherapy, and radiation offering hope, but often causing harsh side effects. Now, a new chapter is unfolding: immunotherapy, which uses the body's own immune system to fight cancer. At the forefront is CAR T-cell therapy, a breakthrough for certain blood cancers. This treatment genetically engineers a patient's T-cells to target and destroy cancer cells. CAR T-cell therapy is FDA approved for some leukemias and lymphomas, offering hope to those with few options. It marks a shift toward personalized medicine, tailoring treatments to each patient's genetics. Years of research have brought CAR T from lab to clinic, transforming cancer care. In this video, we'll explore how CAR T works, its impact, and the challenges ahead. We'll look at the science, the process, and what it means for patients. Join us as we uncover the promise and reality of CAR T-cell therapy. To grasp CAR T therapy, we must first understand our immune system's power. Our bodies are guarded by white blood cells, with T cells as elite defenders. T cells use specialized receptors to identify threats, launching attacks when they find a match. Cancer cells, however, can disguise themselves and suppress immune responses. CAR T therapy gives T cells new tools to see through cancer's camouflage. Scientists engineer T cells with chimeric antigen receptors, CARs, to target cancer cells. These modified cells can recognize and attack cancer, even when it hides from normal immune defenses. CAR T therapy turns our immune system into a precision weapon. It's a leap forward in the fight against cancer. Creating CAR T cells starts by extracting T cells from the patient's blood. In the lab, these cells are genetically modified to express CARs that target cancer. The engineered T cells are multiplied, forming an army ready for battle. After quality checks, they're frozen until needed. The patient receives their personalized CAR T cells via infusion. Once inside, these cells hunt down and destroy cancer cells with precision. Unlike traditional treatments, CAR T targets only cancer, sparing healthy cells. It's a tailored attack, changing the landscape of cancer therapy. Our immune system is a complex defense network, protecting us from invaders like viruses, bacteria, and cancer cells. Specialized cells patrol the body, identifying and neutralizing threats. Some act as scouts, others as soldiers, and some regulate the immune response. The system distinguishes self from non-self using unique cell markers called antigens. When foreign antigens are detected, the immune system springs into action. Strategies include producing antibodies, killing infected cells, and coordinating attacks. This multi-layered defense keeps us healthy, but cancer can exploit weaknesses in this system. That's where advanced therapies like CAR T come in. T cells are the immune system's elite sentinels, trained to recognize and eliminate threats. Each T cell has unique receptors, TCRs, that identify specific antigens. When a T cell finds its match, it activates and attacks. Some T cells kill directly, others coordinate the immune response. Their precision makes them powerful cancer fighters. Yet, cancer often finds ways to evade detection. CAR T therapy enhances T cells, giving them new abilities to target cancer. It's a game changer in immunotherapy. The fight is now more personal and precise. Cancer cells are experts at hiding from the immune system. They reduce visible antigens, making detection difficult. Cancer also creates a suppressive environment, weakening immune attacks. Some even hijack immune checkpoints, turning off the body's defenses. These tactics make cancer hard to treat. CAR T therapy is designed to overcome these barriers. It empowers the immune system to see and destroy hidden cancer cells. CAR T therapy is a breakthrough in genetic engineering for cancer treatment. T cells are collected from the patient and modified in the lab to express CARs. These CARs are programmed to recognize specific cancer antigens. The process ensures CAR T cells target only cancer, sparing healthy tissue. Modified cells are multiplied to create a potent treatment dose. Quality is closely monitored throughout. This approach personalizes therapy for each patient. CAR T therapy is changing the way we fight cancer. It's a triumph of science and hope. After lab modification, CAR T cells are infused back into the patient. Patients may receive chemotherapy first to help CAR T cells work better. The infusion is simple, like a blood transfusion. Inside the body, CAR T cells seek out cancer using their engineered receptors. When they find cancer, they attack and destroy it. CAR T cells can recruit other immune cells for a stronger response. This therapy offers hope for patients with hard-to-treat cancers. CAR T is a powerful new weapon in oncology. CAR T therapy begins by collecting the patient's own T cells. This is done through apheresis, a process similar to blood donation. Blood is drawn, T cells are separated, and the rest is returned to the patient. The collected T cells are sent to a lab for genetic modification. The process is safe and minimally invasive. Patients can usually resume normal activities soon after. These harvested cells are the foundation of personalized cancer therapy. It's the first step in turning the body's own defenses into cancer-fighting warriors. In a specialized lab, a patient's T cells begin a remarkable transformation. Scientists equip them with a chimeric antigen receptor or CAR, turning them into cancer-targeting missiles. Using a harmless virus, the CAR gene is delivered into the T cells, instructing them to recognize and attack cancer cells with precision. This process merges nature and technology, creating a personalized weapon against cancer. With the CAR gene successfully inserted into the T cells, the laboratory, really transforms into a sort of cellular boot camp. It's a carefully controlled environment where these newly engineered CAR T cells go through some pretty rigorous training and expansion, all in preparation for their critical mission against cancer. The expansion process is absolutely crucial, since the initial number of T cells collected from the patient is usually just not enough to mount an effective attack against the cancer. Inside these specialized bioreactors, the CAR T cells are nurtured with a carefully balanced cocktail of nutrients and growth factors, which stimulates them to multiply really rapidly. Over the course of several weeks, the CAR T cell population expands exponentially, creating an army of millions, even billions of cancer-fighting cells. Throughout the expansion process, the CAR T cells are subjected to some pretty stringent quality control measures to ensure their safety and efficacy. Scientists meticulously monitor the cell's growth rate, viability, and the expression of the CAR on their surface. Only CAR T cells that meet the highest quality standards are selected for the next stage of the journey. Once the expansion process is complete, the CAR T cells are harvested, purified, and formulated for delivery back to the patient. This final preparation stage involves removing any remaining impurities and preserving the CAR T cells' viability through cryopreservation, a process of freezing them at ultra-low temperatures to halt their metabolism and preserve their function for future use. After weeks of meticulous preparation, the day finally arrives for the CAR T cells to return to the patient, ready to wage war against cancer. The reinfusion of CAR T cells marks a pivotal moment in the treatment journey, and it's really a testament to the collaboration between science, medicine, and the patient's own immune system. Prior to reinfusion, the patient may undergo lymphodepleting chemotherapy, which is a conditioning regimen designed to create a more hospitable environment for the CAR T cells to thrive. This chemotherapy helps to temporarily reduce the number of other immune cells in the body, minimizing competition for resources and reducing the risk of the CAR T cells being rejected by the patient's immune system. The actual reinfusion procedure is, honestly, relatively straightforward. It's pretty similar to a blood transfusion. The cryopreserved CAR T cells are thawed and infused into the patient's bloodstream through a central venous catheter, which is a thin, flexible tube inserted into a large vein. The entire infusion process typically takes less than an hour, and patients are closely monitored for any immediate side effects. Once inside the body, the CAR T cells begin to circulate, their engineered receptors scanning for their target antigen on the surface of cancer cells. The stage is set for a microscopic battle, really highlighting the power of immunotherapy to harness the body's own defenses to combat disease. The reinfusion of CAR T cells marks the beginning of a microscopic battle within the patient's body, really showing the power of immunotherapy to unleash the immune system's full potential against cancer. Guided by their engineered receptors, the CAR T cells circulate throughout the bloodstream and lymphatic system, seeking out cancer cells that are displaying their target antigen. When a CAR T cell encounters a cancer cell bearing the target antigen, its CAR binds to the antigen with high affinity, which triggers a cascade of signaling events that activate the CAR T cell. This activation process is kind of like flipping a switch, transforming the CAR T cell into a lethal weapon. Once activated, the CAR T cell releases a barrage of cytotoxic molecules. These are toxic substances that directly kill the cancer cell. These molecules punch holes in the cancer cell's membrane, disrupting its integrity and causing it to swell and burst. The CAR T cell can also induce apoptosis, which is a programmed cell death pathway in the cancer cell, effectively dismantling it from within. The destruction of cancer cells by CAR T cells is a highly efficient process, and it often leads to rapid tumor regression. Moreover, the CAR T cells can persist in the body for months, even years after infusion, providing long-term surveillance against cancer recurrence. CAR T cell therapy stands apart from traditional cancer treatments like surgery, chemotherapy, and radiation in a fundamental way. It's a living drug. Unlike conventional therapies, which are administered externally and have a limited lifespan, CAR T cells are living cells capable of replicating and persisting in the body for extended periods. This unique characteristic of CAR T cell therapy offers several advantages. Firstly, the ability of CAR T cells to replicate within the body means that a single infusion can potentially provide long-lasting anti-cancer effects. Once inside the body, CAR T cells can multiply, creating a larger army to combat the cancer. Secondly, the persistence of CAR T cells in the body provides ongoing surveillance against cancer recurrence. Like vigilant sentinels, they continue to patrol the body, ready to detect and eliminate any resurfacing cancer cells. However, this living drug aspect of CAR T cell therapy also presents unique challenges, as the behavior of these engineered cells within the body can be unpredictable. Managing the potential side effects and long-term consequences of CAR T cell therapy requires careful monitoring and innovative approaches to fine-tuning the immune response. The story of CAR T cell therapy began with visionary scientists who believed the immune system could conquer disease. Early pioneers like Emil von Behring and Paul Ehrlich showed antibodies could protect against infection, laying the foundation for immunotherapy. Only with modern genetic engineering did the dream of engineering immune cells to fight cancer become reality. The 1980s witnessed a paradigm shift in immunology and cancer biology with the discovery of the T-cell receptor, or TCR, the molecular sensor that allows T cells to recognize and target specific antigens. This groundbreaking discovery, for which James P. Allison and Tasuku Honjo were awarded the Nobel Prize in Physiology or Medicine in 2018, opened up unprecedented possibilities for manipulating the immune system to fight cancer. Scientists realized that if they could engineer T cells to express TCRs that recognize tumor-specific antigens, they could create a powerful new weapon against cancer. However, TCRs are naturally restricted to recognizing antigens presented by specific molecules on the surface of other cells, limiting their therapeutic potential. To overcome this limitation, scientists began exploring the concept of chimeric antigen receptors, or CARs, artificial receptors that combine the antigen-binding domain of an antibody with the signaling machinery of a TCR. This innovative approach, pioneered by Zelig Escher and Gideon Gross in the late 1980s, allowed scientists to create T cells that could recognize and target any antigen, regardless of its presentation, significantly expanding the potential of T-cell-based immunotherapy. The first generation of CARs consisted of a single-chain variable fragment, or scFv, from an antibody which recognized the target antigen fused to the signaling domain of a TCR. While these early CARs showed promise in preclinical studies, they suffered from limited efficacy and persistence in vivo, highlighting the need for further optimization. CAR T-cell therapy evolved from a promising idea to a life-saving cancer treatment, thanks to decades of innovation and research into the immune system. Early clinical trials showed remarkable results, leading to FDA approval of therapies like Kymriah and Yescarta for leukemia and lymphoma. CAR T-cell therapy has transformed cancer treatment, marked by key breakthroughs. In 2010, Emily Whitehead became the first child cured of leukemia with CAR T-cells. She remains cancer-free today. CAR T therapy also helped the Berlin patient achieve undetectable HIV. These successes led to FDA approval in 2017, and the field keeps advancing. CAR T-cell therapy has revolutionized blood cancer treatment, but its promise extends to solid tumors too. Researchers are tackling unique challenges, like dense tumor barriers and immunosuppressive environments, by engineering CAR T-cells for better tumor infiltration and resistance. Clinical trials are underway, and the potential to transform cancer care is undeniable. The transformative potential of CAR T-cell therapy extends far beyond the walls of research laboratories and specialized treatment centers. As this groundbreaking technology continues to evolve and mature, it's poised to make a profound impact on the lives of cancer patients worldwide. Access to CAR T-cell therapy, however, remains a significant challenge, particularly in low- and middle-income countries where healthcare resources are limited. The complex manufacturing process, specialized infrastructure requirements, and high costs associated with CAR T-cell therapy pose significant barriers to its widespread adoption. Addressing these challenges requires a multifaceted approach, including developing more cost-effective manufacturing processes. Researchers are exploring novel manufacturing techniques such as using off-the-shelf CAR T-cells derived from healthy donors to reduce the cost and complexity of CAR T-cell therapy production. Establishing regional manufacturing centers in low- and middle-income countries can help to overcome logistical challenges and improve access to CAR T-cell therapy for patients in underserved regions. And developing innovative financing models, exploring things like pay-for-performance agreements and risk-sharing arrangements, can help to make CAR T-cell therapy more affordable and accessible to patients in need. The global cancer community recognizes the transformative potential of CAR T-cell therapy and is actively working to address these challenges, ensuring that this life-saving technology reaches patients in all corners of the world, regardless of their geographic location or socioeconomic status. In the annals of medical breakthroughs, certain stories transcend the realm of scientific achievement and become powerful testaments to the human spirit's resilience. Emily Whitehead's journey with CAR T-cell therapy is one such story, a beacon of hope that illuminated the potential of this revolutionary treatment and inspired countless others battling cancer. Diagnosed with acute lymphoblastic leukemia, or ALL, at the tender age of 5, Emily endured the grueling gauntlet of chemotherapy, her young body pushed to its limits. Initial rounds of treatment brought temporary relief, but the cancer returned with a vengeance, leaving Emily's family grappling with the devastating news that traditional therapies had failed. Facing a bleak prognosis, Emily's parents, Tom and Carrie, refused to give up hope. They enrolled Emily in a clinical trial at the Children's Hospital of Philadelphia, one of the few centers in the world exploring the then experimental CAR T-cell therapy. It was a leap of faith, a decision fraught with uncertainty but driven by an unwavering belief in their daughter's will to live. The clinical trial involved genetically modifying Emily's own T-cells to express a CAR that targeted CD19, a protein found on the surface of B cells, including cancerous ones. These engineered CAR T-cells, armed with the ability to recognize and destroy CD19-positive cells, were then infused back into Emily's body, where they embarked on their mission to eradicate the leukemia. The weeks following the CAR T-cell infusion were a roller coaster of emotions for Emily and her family. The initial response to the treatment was overwhelming, as Emily's immune system, now supercharged with CAR T-cells, launched a fierce attack on the leukemia. This immune activation, while ultimately beneficial, triggered a cascade of side effects, known as cytokine release syndrome, or CRS, pushing Emily's body to its limits. Emily experienced high fever, plummeting blood pressure, and difficulty breathing, the hallmarks of CRS. She was transferred to the intensive care unit, where doctors and nurses worked tirelessly to stabilize her condition, administering medications to dampen the immune response and providing supportive care to manage the side effects. Through the ordeal, Emily's spirit remained unbroken, her resilience a testament to the strength that can reside in even the smallest of bodies. Her parents, Tom and Kari, never left her side, their unwavering love and support a source of comfort during the darkest of hours. As days turned into weeks, Emily's condition gradually improved. The CRS subsided, her vital signs stabilized, and the once rampant leukemia cells began to vanish from her blood. Finally, the news that Emily's family had been praying for arrived. She was in remission. Emily's story, though extraordinary in its own right, is not an isolated case. Thousands of patients worldwide have now received CAR T-cell therapy, and their stories paint a vivid picture of the transformative potential of this groundbreaking treatment. For patients like Nick Pipitone, a young man diagnosed with diffuse large B-cell lymphoma, CAR T-cell therapy offered a lifeline when all other options had been exhausted. After enduring multiple rounds of chemotherapy, a stem cell transplant, and experimental therapies, Nick's cancer continued to progress, leaving him with few options and a bleak prognosis. Enrolled in a clinical trial for CAR T-cell therapy, Nick experienced a dramatic response to the treatment. His tumors shrank significantly, his energy returned, and he was able to resume many of the activities he loved. Years later, Nick remains cancer-free, a testament to the enduring power of CAR T-cell therapy to provide long-term remission. These stories, though diverse in their details, share a common thread: the power of hope, resilience, and the unwavering pursuit of innovative treatments that push the boundaries of what's possible in medicine. The decision to undergo CAR T-cell therapy is not one taken lightly. It's a journey into the unknown, fraught with potential risks and side effects, yet also brimming with the promise of a cure. For patients facing life-threatening cancers, the decision often boils down to a delicate balance between hope and uncertainty. It was a very difficult decision, recalls Sarah, a young mother diagnosed with acute myeloid leukemia, a particularly aggressive type of blood cancer. I knew the potential risks, but I also knew that time was not on my side. I had to do everything in my power to fight for my life, for my children. Sarah's journey with CAR T-cell therapy was not without its challenges. She experienced severe CRS, requiring intensive care and prolonged hospitalization. But through it all, she never lost sight of her goal, to be there for her children. The side effects were rough, Sarah admits, but I knew it was my body fighting back against the cancer. And when I finally got to go home and hold my children in my arms, I knew it was all worth it. CAR T-cell therapy is not just a treatment for the patient, it's a journey that profoundly impacts families and loved ones. The emotional, physical, and financial burdens can be overwhelming, testing the limits of resilience and the bonds of love. For the family of Michael, a retired teacher diagnosed with multiple myeloma, a type of blood cancer affecting plasma cells, the decision to pursue CAR T-cell therapy was a collective one. We knew it wouldn't be easy, recalls Michael's wife, Susan, but we were determined to explore every avenue of treatment, to fight for every moment we had together. The family rallied around Michael, providing unwavering support throughout his treatment journey. They celebrated his milestones, offered comfort during setbacks, and drew strength from each other's unwavering love. It was a team effort, Susan reflects. We leaned on each other, on our faith, and on the incredible medical team that guided us through every step of the way, and in the end it was all worth it. We got our miracle. The stories of CAR T-cell therapy recipients are as diverse as the patients themselves, each one a testament to the power of this revolutionary treatment to rewrite the narratives of lives touched by cancer. From young children battling leukemia to older adults facing relapsed lymphoma, CAR T-cell therapy offers a beacon of hope, a chance at a second chance. These stories are not just about medical breakthroughs, they're about the indomitable human spirit, the unwavering bonds of family and love, and the profound impact that innovative treatments can have on the lives of patients and their loved ones. As CAR T-cell therapy continues to evolve, its reach expanding to encompass new cancers and patient populations, the echoes of hope will reverberate even louder, inspiring countless others to embrace the possibilities of scientific advancement and the unwavering pursuit of a cure. These stories are a testament to the transformative power of medicine, the resilience of the human spirit, and the enduring belief that even in the face of seemingly insurmountable challenges, hope can triumph. CAR T-cell therapy is a breakthrough in cancer treatment, but it comes with serious risks. Its power to fight cancer can also cause life-threatening side effects, so patients and families must weigh hope against uncertainty. For many, the chance at remission outweighs the risks, making CAR T-cell therapy a beacon of hope. CAR T-cell therapy can trigger cytokine release syndrome, a storm in the body, as the immune system unleashes a powerful inflammatory response. Symptoms range from fever and chills to life-threatening organ dysfunction. Prompt recognition and intensive care are crucial for managing CRS and ensuring patient safety. In addition to CRS, CAR T-cell therapy can also lead to neurological side effects, which, honestly, is a complex and often perplexing aspect of this powerful treatment. The mechanisms underlying these neurological complications aren't fully understood, but they're thought to involve a combination of factors. These include the direct effects of CAR T-cells on the central nervous system, the inflammatory response triggered by CRS, and the potential for off-target effects, where CAR T-cells might inadvertently attack healthy cells in the brain. Neurological side effects can, manifest in a variety of ways, ranging from mild confusion and headaches to severe seizures, encephalopathy, and even coma. One of the most common neurological complications is immune effector cell-associated neurotoxicity syndrome, or ICANS. This is a constellation of symptoms that can include confusion, delirium, speech disturbances, tremors, seizures, and difficulty walking. Managing neurological side effects really requires a multidisciplinary approach, involving neurologists, critical care specialists, and other healthcare professionals. Supportive care such as anti-seizure medications, steroids, and mechanical ventilation may be necessary to manage symptoms and prevent long-term neurological damage. The neurological side effects of CAR T-cell therapy can be particularly challenging to predict and manage, since they can occur days, weeks, or even months after treatment. Ongoing research is aimed at better understanding the mechanisms underlying these complications and developing strategies to prevent or mitigate their occurrence. CAR T-cell therapy is transforming cancer care, but questions remain about its long-term effects and who benefits most. While many achieve remission, some face relapse or late side effects. Ongoing research aims to refine CAR T therapy, minimize risks, and bring hope for more personalized, effective treatments. The advent of CAR T-cell therapy has ushered in a new dawn in cancer care, a beacon of hope for patients and families worldwide. This revolutionary treatment harnesses the body's own immune system to target cancer, rewriting countless lives' stories. The journey is not over, challenges remain, but the momentum is undeniable. United, we move closer to a future free from the shadow of cancer. The path toward realizing the full potential of CAR T-cell therapy is not without its obstacles. Challenges remain in refining its safety, expanding its use to more cancers, and ensuring access for all who could benefit. Extending CAR T's success to solid tumors is a major hurdle, as these cancers are harder to target and treat. Equitable access is also crucial, requiring global collaboration to overcome cost and infrastructure barriers. The future of CAR T-cell therapy is bright, offering hope to patients and families. Through relentless scientific pursuit and collaboration, we strive for a world where this life-saving treatment is accessible to all. Together, we move toward a future where cancer becomes a distant memory.